Welcome to Surgical Secrets with Dr. Nair, your front row seat to the world of plastic surgery and biopolymer removal. Thinking about a transformation? Or just curious? Revealing the facts and debunking the myths. Dr. Nair cuts through the noise. Surgical Secrets with Dr. Nair.
Hey guys, welcome to Surgical Secrets with Dr. Nair. I'm the host, Kathy, and today we're with the one, the only.
Hey, what's up, guys? It's Dr. Nair, double board certified plastic surgeon here in Miami. Just wanted to welcome you to the podcast again.
So here we're going to be talking about everything that you need to know of what happens at Nair Miami Plastic Surgery, plus with some insights and entertainment. So let's get started. So how are you? Our second podcast today.
Yeah, I'm excited. Doing good.
Yes, so our first one went pretty well. If you guys have not yet watched it, I don't know what you're doing. Click on it. It's going to talk about...
Check it out.
Check it out. Our new practice, Nair Miami Plastic Surgery that he just opened up. Amazing. 3510 CoralWay in Miami. So a lot of patients are getting into like surgery and they don't know what they're even getting into. They don't even know how to prepare themselves for it, which I have been talking a lot about it in like the Instagram, like information they need to know about it. So I feel like we should definitely like touch on that topic.
Yeah, I think pre-op is a very critical and a very important part of plastic surgery. And I think it really sets up the foundation for you to be able to have a successful surgery, a safe surgery, and it helps to educate yourself and your family, your friends. So it is really the first and, sometimes the most critical stage of your surgical journey.
Yeah. How about like people that, like, let's just say for like tummy tuck, lipo 360, HD Vaser, a lot of people get confused on that. Like, what differs from those three surgeries that could help them guide like each procedure to exactly what they're looking for?
So that totally different procedures. So when you talk about tummy tuck versus liposuction, you really want to have a couple of things. So you want to send pictures in to me and you want to come see me in person, and then we want to try and get your goals and see what your do's and don'ts are. So I'll give you a couple examples. So if you have loose skin, there may be a conversation of lipo versus tummy tuck. And that really just depends on how much loose skin, your age, what your goals are, what your financial ability is, and what you want to do to try and get you to have the best result possible. In terms of understanding the difference between liposuction and HD, that's very different. So
a lot of patients ask that.
Yeah.
And it's so really cool.
High definition is fantastic, but it really is for a select group of people. So you have to have a lower BMI. You have to have a good exercise regimen, a good workout routine, and you have to have... Yeah, it's okay.
What's the BMI?
So it varies. I mean, I don't like BMI as a general thing because I think it's very crude. However, you want to have a lower BMI. So I'd say anywhere from 25 to 28 is usually good for a high definition. But the lower you get, the better it is for you to deliver a better result.
The BMI is like the fat you have in yourself.
Not really. So BMI is a very crude way to measure somebody's fat level. What it does is it takes an equation based on your height and your weight, and it delivers you a number. And based on that number, we're able to say, oh, somebody has a certain amount of fat or somebody doesn't. But again, the literature that says that you have to have a BMI less than 30 is more safer is, I think, imperfect. I mean, I think that a lot of surgeons across the United States, myself included, do high BMI work very safely and deliver a good result. I think it just depends on the person. I think a lot of difference with the BMI is also like ethnicities. So African American people or ethnic populations tend to have a higher BMI, but that doesn't necessarily preclude them from having surgery because where they carry their fat may be very different. So if you have a lot of fat in your legs, it doesn't necessarily mean that it's going to affect your tummy tuck, So that's why I don't really like the way BMI does. I feel like it skews the population, but it's kind of one of those things that, it's the only thing that we have. But I think as we get a lot more high BMI surgeons, I think that trend is kind of turning away. I mean, you have a lot of great surgeons doing great high BMI work, and they do it well.
In the future it's not going to matter? Or?
I mean, I think that we need to have a better system. I mean, that's the thing. I think as a surgeon, when you come in and your BMI is 36, I'm not saying you can or cannot have the surgery. I mean, I try to look at that person, look at your health, look at where the fat is distributed, is there any health concerns and stuff like that? And based on the holistic picture of that person, I say, hey, look, you're a candidate for it, or you know what, maybe we need to do this, and this. But as a general term, yes, BMI is useful and it is backed by research, but I'm not a fan of it because I think that it excludes a lot of patients from being able to have surgery. So, I mean, it's there and I take it into account, but it's not the only thing that I use to say you can or cannot have surgery.
Yeah. What are some other things that could, like, affect people to not having their surgery? Like the BMI levels, like, is there anything else that...
Yeah, there's a lot. I mean, pre-surgical planning is very, very, very comprehensive. Yeah. So for me, like, I like to talk to who is going to take care of you afterwards because I want to see if they're appropriate or not. Like, I have people come in and say, oh, I'm going to have surgery and I'm going to have my, 13-year-old kid there with me. That makes no sense. You know, like, I mean, yeah, or you have people be like, I'm going to have surgery. Who's taking care of you? No one. That doesn't work out either. So, it's when you do this and you treat a lot of patients, you see the, like, levels in the society of, like, people's understanding of surgery. Like, at the end of the day, you have to take it seriously. So it is surgery, and the recovery, no matter what surgery you have, it needs to be taken seriously. And if you're not going to be serious about it, I'm not the surgeon for you. So that takes into account what your goals are. So a lot of times people will be like, oh, I want to have a tummy tuck, BBL, breast lift, breast aug, thigh lift, arm lift. And you're like, no, it can't be under surgery for like 7 hours. It's just not safe. So people that are like in a rush to combine a lot of these procedures, they think that, oh, I just want to be a one and done. It's not really safe, and it's not even sometimes the best aesthetic result. So a lot of times splitting the procedures will actually get you a better result and allow it to be safer, allow you to understand, oh, well, I thought that was going to be hard, but it wasn't, or I thought that was going to be easy, and it turned out to be a very difficult recovery for me. Like, I'm glad I split it up. Those are the things that you want to pay attention. And then the other things is just, health stuff. So if you have medical issues, you want to make sure you're in control. You're being monitored by surgeons. It's not like, oh, I have diabetes, I haven't seen a doctor in 6 months. Like, that's not okay. Like, you got to make sure that you're in good health and being managed by doctors. And, a lot of times as plastic surgeons, I mean, I joke around all the time. I feel like I should get, a residency certificate for family medicine because, I'm finding hernias. People have hypertension and they're like not being appropriately managed, and you're like, hey, I'm medically managing these patients, and like nobody else is like paying attention to them.
I know a surgeon in another practice that I used to work at, that a patient came to me telling me that he found literally a tumor, and I think they were doing like a tummy tuck or BBL. I think a tummy tuck. They found like a tumor, literally a box, and like, I forgot what else she told me, but the fact that he literally saved her life.
Sure.
And did, like you said, like more than just cosmetic surgery. Have you ever gotten that done? Like, have you ever seen that happen?
Yeah, I mean, there's a lot of times we're in there and we're just saying, the most common thing is, we're doing a tummy tuck and we'll see a hernia.
Yeah.
And, like I tell everybody, when we see it there, we fix it. I mean, there's 1 or 2 times where we've had like a, especially when you have the larger BMI, you're trying to do an abdominal exam, but because of the fat, sometimes you can't feel if there's a hernia or not. So, you think, oh, it may be okay. And then you get into surgery and you open it up and you see a hernia. So that's also another reason why during a tummy tuck, I don't liposuction that middle part of the belly because I just never know what's in there. And you always want to be careful about it. So if I get a chance to look at it, I'm definitely going to fix it. I mean, there have been 1 or 2 times where, you'll see something that you're not expecting, like on the breast, you may see like a fibroadenoma, but for the most part, like you see it beforehand and you're watching everything.
The strangest thing you've seen?
In plastic surgery?
Yeah.
No, not really. No. I mean, I can't do anything.
That patient told me that they found a box in her. Because she had a tummy tuck done before, like in...
A box?
Yeah, like a box. Because she had a tummy tuck done before, but long time ago. Like,
sure.
If I'm not wrong, it was in... I don't know. She told me like Venezuela, Colombia,
yeah, it
like
wasn't
those
in the United
places.
States. Yeah.
It was not here with us. or nowhere, like even in Miami. And that just shocked me. So you've never seen any?
No, I haven't seen something like where I pull out something crazy out of somebody.
Yeah.
No, I haven't seen something like that. Thank God.
Thank God.
That's not really fun. I mean, well, actually, now that you mention it, I was doing a biopolymer removal on this lady who had like rip-roaring pain. Like she already had surgery done by another surgeon, and she was still having a lot of pain in their buttock area. And so much so, like, she was, like, having trouble walking and moving and all that kind of stuff. And, like, I had scanned her on the scan. I saw some areas, but I wasn't, like, super convinced. You know, like, sometimes you're like, okay, I feel like you're in pain, but you don't believe it. But you're like, all right, there's something there. I got to trust it. Let's go back to the operating room. So I took her to the operating room. Like, she was a little bit older, so I had to do her at the hospital. So I took her back to the operating room, did her in the hospital, and I found these, like, ties. Like, this polyester like ties in those specific areas that she was pointing to that she had pain. Like I don't know how else to describe it. Like it was like a polyester kind of like ribbon that just was like tied into the muscle. I don't know what it was. I
You don't know how it even got there?
I mean, I don't know. It must have been from the other surgeon. I've never seen anything like that.
Surgery.
Yeah, she had surgery before. So I don't know what that was. I mean, I was like, there were like knots. So I took all these knots out. And I sent it to pathology, and the pathologist was like, yeah, it looks like a foreign substance. I'm like, yeah, thanks, man. I'm glad you're putting your pathology degree to use. But, like, I mean, like, that's often why I don't send things. But I mean, they say the dumbest things sometimes. Like, half the time, not to go on a tangent, but like, people always ask me, oh, why do you need the actual CD rather than just, like, the read of the radiologist? When you get a radiology read for a biopolymer, they just say silicone noted. I'm like, yeah, dude, thanks. Like, I mean, like, it doesn't help me where it's located. Exactly. Is it more in the hips? Like, what level of it?
And the biopolymer migrates a lot.
So so I'm like,
yeah.
So I'm always like, just bring the CD because they never give me like a read that I can use in surgery. So that's why I actually look at it. I'm like, oh, look, it's in the muscle, it's by the nerve, or it's, it's in the hips, or it's in the upper back, or something like that. So, I mean, oftentimes, like, you just have to do your own work and you have to know how to read MRIs. And the best way to be proficient at it is you just have to do it. So, I mean, I remember when I was training in general surgery, I mean, all my attendings would make me read my own CTs. So they would like be like, I don't care what the radiologist said, you read it yourself. So we would go through the CTs by ourselves over and over again until we got good at reading it. So, I think doing that kind of legwork makes you more confident because you can find things that a radiologist may have missed, or you may be able to identify what you need to identify surgically, which is very different than what a radiologist does. Like they're looking at the entire thing, making a general comment. But for me, I need something specific, like, where's that silicone? Where's it located? Is it in the muscle? Is it gone through the muscle? Is it by the bone? All that kind of stuff. So you have to just spend your time doing the work. I mean, there's no easy way to become good at it.
And is there any what's the worst case you've seen from when you and how did the patients react towards that? Because I know it could be really scary, especially with the biopolymer, like seeing your MRI and you don't know where that thing could lead up to.
Yeah,
I've heard stories too, which I want to talk about. That's why I'm asking you about this, because I feel like a lot of patients, it's a lot of emotional preparation that you need to have, and a lot of emotional support they need to be prepared to have, because I've seen patients cry and everything because of the polymer. But
just talking about, I've had a couple of rough cases. I had one case that she went to another country and they did this very limited resection. I mean just took out a super small amount, which is I don't, if you're gonna do that, why even do anything? You know what I mean? But anyways, they did that. She came back. She was having so much pain. Her buttocks was literally, I mean, it felt like this. It was just rock hard. She couldn't walk. A mother with kids, it becomes very problematic. You just want to help these people. And so I had talked to her and I said, look, you have a very bad situation here. I mean, there's nothing that's there's no good tissue here. All this tissue is scar tissue and or silicone, plus the scar from the other surgeon. So I took her to the hospital and I had to do these huge rotational flaps. So it was really crazy. Like when I was operating on her, like blood was spurting everywhere. And I was kind of confused because usually when that happens, like as surgeons, we're looking at the blood pressure and we're like, we're like getting mad at the anesthesiologist. We're like, hey dude, keep the blood pressure down, But I kept looking at it and the pressure was low. And then I realized like there was so much tension from the scar and the silicone in her buttocks that when I would make a cut, the blood was just trying to get out, so it would just spurt out. It was very, very crazy.
Oh my
So
God.
like,
and it was really messy, everything.
yeah, it was. Yeah, it was a very tough surgery. So I was able to cut out the entire area. But the thing about the buttocks is like you can't just skin graft that area because the problem is like you need to be able to sit. So you need that. The buttocks was created to have cushioning for you to be able to sit. Otherwise, like you just erode through the muscle. It's a lot of pain. It's problematic. So I can't just leave it there, or I can't just put a thin layer on there. So what I did was I rotated a muscle flap from her back and I rotated a muscle flap from her thigh to create a neo buttocks for her. And so, she did really well with that, and she's doing fantastic. But one of the things that really brought me, that took me like 7 hours to do that surgery.
7 hours
Yeah.
in the hospital?
Yeah, I think I finished at like midnight or 1 or something like that. But one of the things that was really impressive about that is like the level of support her family had. And I think that, yes, I did what I did, but I think the reason why she's been so successful is how aggressive and supportive her family has been.
That's what you need.
It is, I can't tell you how important that is because people think like, oh, I'm just going to get on her own. And it's not. Like surgery is so aggressive. Like you need help, you need support, you need family involvement. Like it's not something that you can do in isolation. You know what I mean? Like if you're having surgery, it's kind of like we're all having surgery. You know what I mean? Like your family has to get involved. Your family has to change their schedule to like take care of you.
And especially biopolymer.
Yeah, especially biopolymers. Yeah.
Is cosmetic surgery, but it's more like health-wise.
Yeah.
Like it's more, in situations like that, imagine how that girl felt.
Yeah, no.
And plenty more cases, and I want to talk about
Sure.
one. Like the patient who, I remember I was in the room with you translating her MRI, you were telling her everything, and you were telling her how her biopolymer is right on top of her nerve system, and she could possibly lose her leg.
Well, removing it.
Yeah, removing it.
Yeah.
She could possibly lose her leg.
Yeah.
And thank God she had her husband there with her. Thank God she had her little support. I was even there like calming her down, telling her he didn't say it's going to happen, but you just need to make sure. And next time you do cosmetic surgery, like be careful, guys, because it's really serious. It could affect your life, like actually. And I know she's not the only patient going through this. A lot of patients goes through stuff like that.
Yeah, you have to pay it. That's the thing. Like once the silicone goes through the gluteal muscle. So if you look at the MRI, it goes through the gluteal muscle, and once you go through the muscle, you get involved with the nerves and the veins. So involvement of the nerves and veins ends up becoming, problematic because if you're not careful in your dissection, you can injure things. You have to protect it. So that's rare. That's not a common thing. It can happen. But those are things that you want to pay attention to. You want to, that's the whole reason why we get MRIs, to see where the silicone is located and how to make sure you treat it. The other one I was going to tell you about was that one lady who had silicone all over her thighs, and it had migrated to on top of the femoral vessels, which is the blood vessels in your leg. So that was the one that I was talking about. God forbid I go in there and I'm dissecting it and I injure the femoral the femoral artery, you bleed out very quickly. So those are surgeries that you have to do in conjunction with another surgeon. So that specific surgery I did with a vascular surgeon, and him and I went in together, and we took care of the blood vessels and made sure the blood vessels were safe, and then I was able to cut everything else out. So, she's doing great from that. She didn't have any damage to her nerves, no damage to her vessels. So she's doing fantastic. So there are like rare cases where it gets, very tricky. You just have to know what those cases are.
But that's usually just a biopolymer. Like it's never like, is there ever you see like any complications like when it comes to like BBL or tummy tuck, like that a patient could have themselves that would make the procedure harder?
Yeah, I think a lot of times when you talk about like BBL tummy tucks, for tummy tucks for the most part, you want to talk about like revision. So a lot of times, depending on the incision placement for the most part, or if people have done, aggressive liposuction, you get a lot of scar tissue. It's harder to reshape that area. But in general, that is not as hard of a revision. BBL revisions are a little bit harder because it's unpredictable. Because a lot of times, like I've seen a lot of patients who haven't had BBLs done in the United States, they get a lot of fat necrosis because instead of spreading the fat out, they just inject it in a single globule. And a lot of times that single globule won't have like the best blood supply, so the fat doesn't take as well. So revising those patients ends up becoming very difficult. So those are the kind of things that you want to pay attention to when you do revisions on those surgeries.
And how about with like the post-op care? What's some things that like patients should be aware of and prepared?
So post-op care is really important. I think that pain control is always something that everybody's always thinking about right off the bat. I think that's highly important. I'm a big fan of Exparel. I wasn't super set on it in the beginning. I was like, I don't even, like we were using it for BBLs, like patients would pay for it. And I'd be like, I don't even feel like this is going to work. But I would go to PACU and I would see these patients and I would see like a patient that I did a BBL on that didn't have Exparel and they'd be waking up in pain. And I'd be a patient that I did use Exparel on. They're like, yeah, it's not bad. And I like pretty much routinely require it on all my biopolymer patients because when I'm dissecting in the muscle, it's painful, and if I have to excise muscle, for sure it's painful. So like I really just try and inject in there, and these patients often do well. Like I had a lady who for some reason had some issues, like the pharmacist wouldn't fill her pain medication and she only had Tylenol and the Exparel that I injected her, and she came in the next day and she was like fine. It was crazy, so like it's those kind of experience where you're like, all right, I think they should get it.
Biopolymer or
everything. Like when I do,
so you feel like what is that medication kind of? Exparel.
Yeah, so it
should be taken. Like you should have it for you before any procedure.
Yeah, so I'll describe what we use it for. So like on our breast surgeries, we inject it as a block. On our tummy tucks and stuff like that, we inject it into the muscle and we do something called a tap block to protect the abdomen. And then for our BBLs, I mix it in with the fat and I use it for the fat. So really the only areas that you don't need it is if you're doing just straight liposuction. But other than straight liposuction, almost every other procedure, I think it's worthwhile. I mean, it really cuts down on the amount of narcotics you use, which cuts down on constipation. Obviously, people being on narcotics is never good anyways. Those are the things that I think are important for pain control. Outside of that, postoperative care is really just tiered towards your surgeon. So for me, I'm very hyper aggressive about post-op care. So I do a tiered kind of thing. So at least in your early post-op, I want to see you in person and I want to see you all the time.
No, all the time after the surgery.
Yeah.
He's always there in each room, minute by minute, with each patient who just had surgery.
Yeah.
That's amazing.
Yeah, I mean, it's part of what we do.
Yeah, but not a lot of surgeons see their patients right after surgery. Usually it would just be their medical assistant, which is not bad. The medical assistant already have the care and the knowledge to already take care of them. But you as a surgeon, you want them to know that you're still there. You're still looking out for them.
Yeah, I mean, I think that's part of my philosophy. I like to be involved with it. I like to see my results because, I mean, as a surgeon, you're only going to grow by seeing your own stuff. So if you look at, I don't know, a BBL or a tummy tuck, and you're like, I like that, or, oh, no, I don't really like that, you can change. But if you don't look at your results and you don't track them over time, you're never going to know how to get better. You're never going to try new things. You're never going to figure out how to like tweak things to make it easier for patients. And like you said, the other thing is I want people to know that I'm here. I spend a lot of time on my Instagram. I spend a lot of time in post-op recovery. I spend a lot of time in pre-op, just to make sure. I mean, I have patients that I have done like I've talked to for like 6-7 months before they have surgery. You know what I mean? So like that I love because we've established a relationship. I know you know me. We have a really good understanding.
And I feel like that's the key thing to grow and be successful. Like, have relationships with your patients, with your clientele. Like, make them feel safe, make them feel wanted, which they are. But a lot of people do not go by that. A lot of people don't acknowledge how important those things are.
Yeah, I mean, like, I've said this before, but I think, like, I really do want to be friends with my patients.
Yeah.
Like, I want to be able to
I know.
I don't know, just call them up and be like, hey, what's up? How you doing? Like, I'll be like hanging out one time. And I'll like message, be like, hey, I thought about you in a while. How you doing?
Yeah.
Kind of stuff, like.
And they would to you too.
Yeah. And I really like that because it energizes me. It gets me, because there are times where, you just feel like, man, like I'm getting bogged down with this, or it's not something I want to do. And there's always like that one patient who will like message you and be like, just out of the blue, like you're not saying anything, and be like, hey, I really loved your work. Thank you so much for what you did for me, blah, blah, blah. And like right then I feel like, this is why I do it. I got this.
Exactly.
This is why I do this. Yeah. So it's just people like that like really uplift you, and it's like a community, and I like being part of it, and I like the way that they take care of each other. I like how my patients are very like kind and supportive.
And they always gift you things.
Yeah, they're very, very sweet.
What did the first day you went in office, didn't they give you like chocolate?
Yeah, I had a bunch of people give me like chocolates and orchids and stuff like that. Yeah, it's very
orchids,
nice.
Chocolates.
Yeah.
I know one who has a gift coming up for all of us, even me.
Well, that's very
the medical assistant.
Yeah, no, she's very sweet.
You don't know who she is, but she's gonna surprise. Yeah, she's gonna surprise us.
Yeah, good. That's nice.
So back to the post-op care.
Yeah.
What are some things like massages? How does massages benefit? The procedures.
So I'm a big fan of massages. I mean, I do not drain my lipos. I do drain my tummy tucks, but I don't drain my lipos. A lot of that is because I really want to force you into a situation where you're getting massages for a couple of reasons. I think it is, and I tell people this all the time, I don't think liposuction is that traditionally very difficult. I mean, a lot of people do it. A lot of non-plastic surgeons do it, and they do a decent job. I'm not saying they're going to do what we do, but the key to having a good result is the technique and the massages, because it reduces the swelling, it reduces fibrosis, and specifically for high definition, I mean, I will not do high definition with you if you're not going to do massages.
But a lot of people don't know that.
I know. And
I know people who get surgery and they don't even get massages.
Yeah, it's very... I think it's very detrimental for your success. I think it helps you feel better. It helps get rid of that swelling.
I've heard it's 50% surgery, how it comes out, and then 50% the aftercare.
Yeah.
Such as like massage is the most important one.
Yeah, I mean, I tell people with HD specifically is, look, I did the easy work. You got to do the hard work.
Yeah.
I mean, for HE Vaser specifically, I mean, I want at least 10 to 30 massages once a day, starting day one after surgery. You got to wear what I call progressive compression. Yeah, which is like the foams, the foam on top, a foam pad on top of it, abdominal board, faja, and then a waist trainer. And then even for tummy tucks, you got to get the massages on the flanks. Every time that we're doing any kind of even regular lipo, I like to get the massages because it just makes a difference. It helps move around a lot of the swelling so you don't get fibrosis, and it helps you feel better too. So I'm a big fan of it. I think it's a great part of your postoperative care.
And what are some things that patients could do to like avoid fibrosis? Hernias, do you get it from plastic surgery?
No, you shouldn't.
No,
I mean, anytime you have an incision that goes through the belly, that's usually what you can say. But no, you're not going to get that from plastic surgery.
But like fibrosis, infections, like what should they not do to get that?
So,
which I know it doesn't happen a lot, but...
Yeah, it happens. I mean, not a lot, but it does happen. So fibrosis and infections are two different things. So for infections, you want to obviously shower beforehand, with chlorhexidine or Hibiclens. Make sure you're clean. Make sure you don't have an infection. You're not getting sick. I mean, I had a lady last week who was like, in my pre-op, she was like, oh, I feel like I'm getting sniffles. Canceled. You know what I mean? Yeah, because she was like, oh, I feel like I'm getting sick. And then we just did her.
So you can't even like...
No, if you're sick. No, if you're sick, you can't have plastic surgery. Yeah, I mean,
not even runny nose, little cough.
No, none of that stuff.
Wow.
Yeah, so I mean, she was getting sick. She wasn't sure. If it's allergies, it's one thing. But if you're sick, we're not. It's just not safe. It's not worth the risk. So you want to make sure you're doing your postoperative care. And then any which way, I don't trust anybody. So I double cover you on antibiotics anyway. So I try to cover you as best as I can, and I put you out for a long time. So you take about antibiotics for about 10 to 12 days sometimes. And for the most part, the infection rates get pretty low. I mean, knock on wood, I haven't had anything that's very significant. Doesn't mean it can't happen, but we do a lot of things to try and protect and prevent. And a lot of it, what happens is, to be honest with you, other than those things, it's postoperative care. Because if there's an issue that arises, you want to jump on it quickly, and you want to pay attention to it, make sure it doesn't become a problem, make sure there's no issues. Like, I'll give you an example. I don't operate on people who have UTIs, because even though you may tell me, oh, I don't feel anything, I feel okay, if you have bacteria in your urine and then we operate, there's a chance you can get an infection. So if you have an infection, I'm not going to operate on you. Another thing is, if you're a diabetic, even if you're controlled, I'm still going to get worried about you. So I kind of follow you a little bit more and make sure, hey, you're doing okay, everything's okay, no problem, no fever, nothing like that. So because diabetics, unfortunately, are susceptible to having an infection. So, they're a very low percentage. I mean, it's like less than 1%. So think about it. If you did 1,000 surgeries, you only 10 people you would be worried about. But you still want to be worried about them. You still want to take that into account. You still want to watch them. And, you want to do all the sterile technique, everything you can to protect it. But a lot of times, things are just inevitable. You just can't control everything, unfortunately. So postoperative care is what helps you mitigate problems. So you sit there and say, look, if there's an issue, come talk to me quickly so I can kind of get you fixed up before it becomes a big problem.
Mm-hmm. So you said UTIs, diabetes, and being sick could stop you from getting your surgery canceled. Is there anything else? Because I did not know that.
Yeah, like smoking. If you're smoking, yeah. Like if you're smoking and you're a diabetic, I mean, it's like the worst thing in the world. Yeah. I mean, like you can pretty much guarantee nothing's going to work on that surgery, So that's going to get you canceled. For me personally, it's like drugs, like if Ed lying to me, that really sets me off. Like, listen, I can't tell you how many times people have been like, I don't know how this got in there, or I have this disease and I didn't tell you. Like, I had to cancel somebody because they didn't tell me they had like a disease. I'm like, why would you not tell me that? Like, I can't tell you the level of like frustration that is. Yeah. Huh?
What disease was it?
I mean, it was just like some health stuff. I don't really want to go into it, but like, I'm not discriminative or anything like that, but you cannot withhold information from your doctor. It just makes no sense. You know what I mean? Like, you're putting your health at risk, and you're putting my reputation, my job, my family, you know what I mean? And it's just crazy. I don't know why you would lie about those things. You know what I mean? It's not like you can't have surgery or you can't do this, but you have to tell me so I can make an educated decision.
You caught them.
I know, but I'm saying,
how do you catch it?
Because we do lab work. So then people think, I mean, you know what I mean? Or we'll find certain ways or honestly, sometimes I believe in God. Like, I feel like I just get lucked out of it, because like
there's been times that the lab work didn't say anything.
No. And then, or like randomly, like I'll be reading a, like they'll say no for a bunch of stuff, right? And then randomly I'll read one note in their doc that says, oh, by the way, you have like sickle cell disease. I'm like, why didn't you think to mention that to me? You know what I mean? Like, or just crazy things like that. So I really, really think that if you're going to lie, go to a different surgeon. I mean, don't even go to a different surgeon. Don't
get surgery.
Just don't get surgery. You're not ready.
Yeah.
And if you're not ready, that's okay. Get ready. Take the time. The other thing that is, they have a lot of people that are like very psychiatrically not ready to have surgery. And I think that's like a very big thing and a super overlooked thing. Like, people that come in and start like shit talking another surgeon, if they're not board certified, all right, whatever. But if you're shit talking another board certified plastic surgeon, like, that makes no sense to me. Like, almost all of us are always trying to do our best job.
Yeah.
And we're always trying to be safe and do things. So, making somebody into a villain over a complication or you don't like something, to me, shows that you're not in the right space to have surgery, because things can happen. You don't have to like that person, but you don't need to make that person into like the worst person in the world. And then they're like, oh, you're my savior. And I'm like, listen, we're all trying to do the best job we can.
You guys studied all those years for a reason.
Yeah.
You guys are surgeons for a reason.
Exactly.
And sometimes things can, like you said, things
can happen. And so it's not that one guy's better than another or this or anything. It's just that some people have a better affinity for certain things, or you click better with them. And the way I say it is kind of like this, like, you may get married to one person, but that doesn't mean everybody else is just garbage.
Yeah.
It just means you clicked with that person a lot better. You guys have a better rapport, but it doesn't talk down on everybody else in the world.
Because at the end of the day, they're all still trying to find the marriage.
Exactly. So what I'm saying is, for patients, you should find the doctor that clicks with you the best. And it can be various things. Like, it can be, I want a surgeon who's just the best academic guy in the world. Cool, go for it. I want a surgeon who's very, very nice and I can talk to them all the kind of time. Sure, go for it. I want a surgeon who's the best at breast, but I don't really care if they're bad at everything else. Cool, go for it. So again, there's a lot of board certified plastic surgeons in the United States. You should pick them. The whole thing about board certification is it gives you a base to be confident that you have a level of safety and the surgeon has a level of training. And so at that point, you at least have a baseline where you think that, this guy that I'm going to, he's going to be safe and he's going to treat me with respect and treat me as best as I can. So I think that's the difference between board certification by the American Board of Plastic Surgeons and just what we call cosmetic surgeons.
Cosmetic surgeons. Yeah. And not a lot of people know. I didn't know what a board certified plastic surgeon was.
Yeah, I was telling you, my best friend, I was having a conversation with him the other day, and I was talking to him about it. He's like, I didn't know there was a difference.
I didn't know there was a difference.
I've literally known him since I was 16, and he doesn't know.
I was like, you're a plastic surgeon? You're a cosmetic surgeon?
Yeah. No, totally different. Totally different. So I went through an extensive amount of training.
But because some people, how can they find out? It should already be stated, or how do they know they're not it? Because, for example, you have it in your bio on Instagram, near Miami Plastic Surgery. You have it, everywhere. You always make it known. In the introduction of the podcast, you're like, I'm a board certified plastic surgeon. How about the people, the ones that aren't? How do they know they aren't that?
So,
what's something that...
It's kind of slick. So there's two ways.
Because I know some don't talk about it, or
Correct.
They try to be slick and they act like they are it.
That's the way. You got to be smart about it. So if they're not using the word board certified plastic surgeon, then they're not a board certified plastic surgeon. So you can say you're a plastic surgeon, but if you're not board certified, you can't use that word. And if they use the word cosmetic surgeon, you can pretty much guarantee that they're not plastic surgeon.
Because a lot of them are on Instagram saying, I'm a plastic surgeon.
Yep.
I'm a plastic surgeon.
Correct.
But you're not a board certified plastic surgeon, and that's what matters.
That is what matters. Yeah. I mean, I think that's the difference. The other way to do it is you can go and look them up. So, if you go and look up my name on the American Board of Plastic Surgeons or ABMS, which is the American Board of Medical Specialties, you can see, where my board certifications are, and you can see where I'm board certified, all that kind of stuff. So for the American Board of Plastic Surgeons, you can see my name and it says it's board certified.
We need to let people know that.
Yeah, for sure.
A lot. Put that out there as much as possible. Only get surgery with board certified plastic surgeons.
Yeah, absolutely. I mean, I think that our training is a cut above the rest. I think that the level of work that we put into it, the level of stress and stuff is for the patients. I mean, it's so that you guys are safe. That's really what it's about.
Exactly. And it's not even about the years of training or whatever to get the board certified plastic surgeon certificate, but it's also, it shows that with you there's going to be no risk, no complications, no nothing compared to just a plastic surgeon.
Yeah, well, I don't know about that. I hope so. But, I mean, it basically says that, I have an understanding of what can happen in surgery, and I go out of my way to prevent it. And if there is a complication, I know how to fix it. So I think that's what it tells us. The level of training that I've been through, I've seen so much, and I've been trained by so many guys.
If a regular plastic surgeon is doing surgery or whatever happens and there's a complication, he won't fix it? What...
Well, I don't know.
Or would he go to send that patient to a board certified plastic surgeon to...
No, it's not like that. It's just that if you're not board certified, the question has to then start getting answered, well, why? Like, why aren't you board certified? Like, what happened? So is there an ethical issue? Did you not have cases? Did you mismanage your cases? You know, all that kind of stuff. And it's not a... And the other time is, like, you know, once you get out of practice, you have to submit a case log to the American Board of Plastic Surgeons. So guys that have just graduated, they can't call themselves board certified plastic surgeons. So it doesn't mean that they don't have less of a knowledge, but they will also, but those guys are also very smart. So they'll say they're board eligible, meaning they're eligible to take their boards. They just haven't passed it yet. So that is the only thing I'm saying. But if you're past the eligibility, then you have to have a conversation of, well, why didn't you pass your boards? What happened? You know?
Yeah.
So that is what I would say. But that population is very, you know, few and far between. You know, it's very small. The majority of the issues that we have is between plastic surgeons and the cosmetic surgeons. That is the level of difference, because we're all trained in...
what's the difference?
So the difference is we're all trained in either 3 years of plastic surgery after general surgery or 6 years of plastic surgery right after medical school. So we've had an extensive amount of plastic surgery training, and that's not even including the guys that have done fellowships. So I did 2 fellowships. I did a fellowship in cosmetic surgery or aesthetic surgery, and then I did a fellowship in craniofacial or pediatric plastic surgery. So I can do cleft lips and all that kind of stuff. As a cosmetic surgeon, they can do any residency, almost anyone. So they can do dermatology, family medicine, internal medicine, dermatology, orthopedic surgery. I mean, any other specialty they want, and then they do 1 year of something called a cosmetic surgery fellowship, which is managed by the cosmetic surgery people, and then they call themselves, you know, cosmetic surgery, cosmetic surgery surgeons. So that's different than what we do. And in 1 year, I don't think that you can get the level of training that we get in 3.
Yeah.
And it's just... it's just different. The American Board of Medical Specialties doesn't recognize them as being a cosmetic surgery, the cosmetic surgery as being a board. Now, they're fighting to get into that American Board of Medical Specialties, but, you know, we don't feel like that training equates to what we have.
Yeah. So for people who are watching this, let's just summarize it for them. So they want to get surgery with us, right? They call our number, 305-488-5707. They speak with Mercy. She does a consultation with them virtually. She does, what's the next step? Like,
so yeah, either that way, or they'll contact me on Instagram, or they'll contact me through the website and
but
send
then
me
you
stuff.
Put the phone number, you get their name and phone number, and you send it to Mercy. Okay.
We send it to her, and then what they'll do is usually they'll send her pictures, and Mercy will send me those pictures, and then we kind of talk and say, oh, I think that, you know, just say, oh, they're looking to get lipo, and I'll say, oh yeah, that sounds good, or you know what, I don't think that's going to work out. I think they need a tummy tuck or whatever it is. Then after that, we set up a consultation, and we do a virtual consultation if they're not in Miami, or if they're in Miami, I try to have them come in. And then we kind of talk in person, and I try to get to know them, see what their goals are, see what they think they need, you know, what they're trying to get to, and how I can best help them get in that journey. And then after that, they get in touch with my coordinator, Maciel, and she does, you know, hey, these are the labs you need to get. You know, you seem to have high blood pressure. We need a clearance from
this.
And
what are the labs they need to get?
So the labs is a good question. So the labs are pretty general for the general population. Let's say you didn't have any issues, you're a pretty healthy adult. You know, then we'll get you like a CBC, which is for your blood, CMP, which is also for your blood, and then PT, PTT, INR, which is a coagulation, like how thin your blood is. HIV, if you're a female, a pregnancy test to make sure you're not pregnant. And then we'll recheck you again on the day of surgery to confirm that you're not pregnant. And then an EKG, chest x-ray. If we're dealing with breast surgery, sometimes we'll need a breast ultrasound and a mammogram. If we're doing biopolymers, then we'll need an MRI, depending on whatever part of your body that is. Let's see if I missed anything else. And then a urine test. So we need a urine analysis.
The drugs.
Yeah.
Okay.
Yeah, and then once you get here, we'll do a urine drug screen.
Okay.
Yeah.
And that's with Maciel. And she makes sure everything's correct with it.
Yeah, we try to get that done well ahead of time.
And that's already, like, patients who are not from Miami, that's already when they come in Miami, they do those lab works here in Miami.
Or they can, but I'd prefer to have it done well
already
beforehand.
Have it done beforehand. For when they come see Maciel, she just tells them, oh, this is, like, you're all good. Yep. If it isn't right, either way, we provide them with, like, a clinic they could go by near.
Yeah. I mean, if you've never had, we try not to do that because I don't like doing things last minute. But let's say you've never had blood work done and you're having surgery, then I'll do your blood work for you. Okay. But I'd prefer for you to kind of have it done before you meet me, because that way I can identify issues like, oh, your labs are a little high here. What's going on? Oh, I was sick. Okay, cool. Let's redo it. Something like that. So I try to get things done ahead of time so we're not having this last minute tirade. But worst case scenario, like you're like, hey, look, I'm healthy, I've never had labs done, I don't have a primary care doctor, blah blah blah, then we got to get you plugged into the system, we got to get you hooked up. And a lot of times, it takes a while to get into these doctors, you know what I mean? Like if you need a cardiac consult or you need this, sometimes they're booked 2-3 months out. So I always tell people, the sooner you're deciding to have surgery, start planning then. It's a bad idea to like wait. Just the second you figure out that you're comfortable with me, I think Dr. Nair is a good dude, I want to have surgery with him, then let's start getting going, because it's just a problem later on. You can't ever have stuff done early enough. You know what I mean? Like that's never a thing. So always get stuff done so I can help you identify, what the issues are.
So after the lab work with Maciel, that's it?
So after that, so then after that, we just follow up. We do a second consult just to follow up and make sure. Just to make sure like there's no issue. So it's not as aggressive as the first one. It's just kind of like, hey, everything looks good. Do you have any other questions? Do you have any concerns? Is there anything else? And I try to make sure, I try to get an inkling of, hey, do you know how your post-op's going to be? Who's taking care of you? I try to talk to the post-op person. Hey, this person's going to need this, that, and the other. Who's coming down with you, blah, blah, blah. Because, things can change. Like I had a lady last week who, her mother-in-law was going to come help her, bailed on her at the last minute. So then, and then I had to like call somebody to be like, hey, we got to get you some help. Yeah, so she didn't have anybody to take care of her. So, we gave her the name of one of a great recovery nurse. She did great, fantastic. So, there are things that come up that you just don't expect. So I always try to like anticipate.
It's a complicated field.
Yeah.
Same things when people want to see you for their follow-ups and afterwards. We don't do appointments for that reason.
Yeah.
Because right now I could tell you to come in at 11, but at 11 something happened. Not necessarily something bad, but like I said, it's a complicated field. And the surgery, instead of taking 2 hours, it took 1 hour, 30 minutes. Let's just say it took 2 hours.
Yeah. I think it's difficult to kind of like plan for something. We try to give you a general time frame.
Yeah.
We try to really plan it and all that kind of stuff. But you got to think about it this way. Like I'm seeing post-ops while we're flipping a patient and everybody's cleaning the patient. I'll run out, go see a patient, jump back in, then start the surgery. Or, once we're done with surgery, while they're cleaning the room, I'll go see a patient or see a consult or make phone calls I need to. So like in between surgeries and in between consults, like I'm always doing something. We try to get it as, clean cut as we can. But things are.
But you need to always remember it's a complicated field.
Yeah. So sometimes people will be like, oh, I've been waiting for an hour, and it's never because I'm sitting there eating lunch. You know what I mean? Like it's always because I was in surgery. Or like I was in a consult with a patient who wanted to talk a little bit more. Like we have we'll get some patients and they'll just talk, and you don't want to be like, hey, look, I gotta go. Sorry. So you have to sit there and listen to them and get their concerns out. Sometimes I'll be like, look, I really gotta go. I'm sorry. But. So things are very, very unpredictable. It's a very fluid field. Reminding patients to have patience is, it's always important.
No, like you said, more. It's a really like everything it's out of our control.
Yeah, and patients are usually really understanding, because I always tell them, look, if it was you or your family or your loved one on the table, would you want me to be like, I gotta go?
Yeah.
No, of course not, right? So. Once I say that to them, everybody's usually like, oh, yeah, no, I understand. Do what you got to do.
Yeah.
I'm here. And for the most part, we've got it down to a
No, yeah.
sides. I mean, we spend a lot of time trying to get through the schedule. I mean, we're constantly texting, oh, change the time to this, change the time to this. Or like, Raven will hop in surgery. Hey, I got a patient waiting for you. How long is it going to be? I'm like, hey, give me like 20 minutes. I got to, finish this case, So like, we're always like, as a team, we're always working to try and do the best job for everybody. As much as we can. So.
Yeah. So back to the, like, they don't know about us. They're trying to get their surgeries. They just got their labs done, work with Maciel. They come in to talk to you.
Sure.
What's the next step?
So once the next step is, and then you kind of decide, hey, I feel like what Dr. Nair said makes sense. I really like it. Or, I don't really want to do it. I want to think about it, blah, blah, blah. So once you make that decision to proceed with surgery and you've already got your lab work done, then I think the next thing for you is you want to make sure all your postoperative care is ready. So you want to book all that, book all the massages and all the stuff that you will need afterwards. Make sure you have everything in line. You're paid. There's no issues with the financing or anything like that. Once all that is done, you're ready to go.
But talking about finance, I did not know that with you have your procedure now and you pay later. I found that out Thursday, which was like 2 days ago.
Yeah.
That's always been a thing?
Yes.
Can you talk about it?
Yeah, it's just financing. So basically what you can do is you can book your surgery and you can pay in installments and all that kind of stuff and pay later. So it kind of gives you an opportunity to, have the body you want and get or, fix your biopolymer issues or whatever the surgery is that you're trying to have and work on paying it off later. So it's not something that you have to do beforehand and, it gives you a chance to have the surgery before. So.
And you use Care Credit.
Yes. Yeah, his Care Credit, a bunch of other financing companies too as well.
That's good.
Yeah.
So after, let's just say they decide with you, that's it. They get in the surgery, they get scheduled for their surgery dates.
Yeah.
What should they prepare for that day?
So what you try to do is you try to come to, let's say you're in Miami, then you don't really need to worry about it. But if you're from out of city or out of state or whatever, I like you to come to Miami about 2 days before. Walk around. If you're on a long flight, definitely walk around for a day or two before to get that blood going. And then just get used to the environment, get used to whatever you need to do. Come see me. So then the day before you come see me, we make sure everything's okay. We do a last minute consult again just to make sure nothing had changed in the last time, because sometimes things happen. I had a lady who was ready for surgery and then all of a sudden she's like, I haven't had my period in a while. I'm a little bit worried. I'm like, let's get a test. And then, you know what? She was pregnant. So surgery's canceled. So, there are things rarely, but there are things that can happen, but we just want to make sure that nothing. So we do kind of a last minute, check up, make sure everything's good. We're all good with labs. There's no issues, nothing that we need to change. We're still on the same page. And then you just get ready for surgery. So then the day before, you stop eating at midnight.
12 hours before.
Usually about at least 6 to 8, but usually 12.
Okay. Because I got told that some procedures are different. Some procedures, like an example, don't mark my words, but tummy tuck could be you can't eat 6 hours before, but breast lift could be you can't eat 12 hours before.
No.
That doesn't.
No, it doesn't matter. It's just all about general anesthesia.
Okay.
So the whole eating thing is for general anesthesia. So usually what we say, at least in the hospital setting, is about 6 to 8 hours is all we need to. So it's just that we don't want you to throw up while we're eating and then you have a lot of food in there and it could get into your lungs and that can become a big problem. So that's why we do it. And the other thing, which reminds me, is if you're on Ozempic or Mounjaro and all that kind of stuff, you need to stop that at least 2 weeks before surgery, because a lot of times that can slow down your gut. And so if you haven't stopped it for more than 1 or 2 weeks, then it could cause a problem when we do an intubation. So that's the reason why that we say not to eat. And
birth control too.
Yeah, birth control is a month. Birth control is a month before surgery. A month after surgery, you need to stop.
And how about this goes with the females, because a lot of females probably have IUDs, the implants. Does any birth control, but does any of specifically IUD or implant affect with the surgery?
So IUD, it depends. If the IUD is a copper IUD, you're good. You don't have to worry about it. If it's non-IUD, talk to your surgeon. I mean, there's differing opinions on it. Some people think it does. Some people don't. I mean, I would say if you have a chance to remove it, get it removed. But it's not an easy thing to get your IUD removed. Same thing with the implant in the arm. The implant in the arm, I think, is even worse. So, yeah, if you can get that removed, I really strongly get you to remove it. But, you know, again, it's
but in
surgery.
a lot
it's
of
tough.
cases, they can't. So it wouldn't.
Well, I mean, you just have to understand. So that's the thing. You have to have a conversation. Look, I think this does increase your risk of having a blood clot. What are things that we can do? If you're a lower BMI, you know, I think we can tolerate the risk. If you're a higher BMI and you're having like a high risk clot procedure such as a tummy tuck, then the conversation is, should we do surgery? Should we wait? Should you get it out? Do I need to put you on blood thinners? You know, it's a conversation that I think is
all of these
doctor to patient.
All of these conversations would be like in the first consultant?
Yes. Yeah. I mean, oftentimes, like, we try to address it in the first time, but a lot of times people will be like, oh, yeah, no, I forgot.
Oh, by the way.
Yeah, by the way, yeah. But, yeah, ideally, we would like to do it in the first conversation. But, you know, it whenever it comes up, we address it at that point. And the other thing is Depo. Depo I hate because Depo lasts for 3 months. So that's the only birth control. It's like a shot. For birth control. So if you're on Depo, you need to be off Depo for 3 months before you can have surgery. Yeah, because it lasts longer.
And is there anything specific they should wear? Because I heard they could wear like sport, like they have surgery.
Day of surgery? No, just come comfortable.
Comfortable?
Yeah, that's fine.
Okay.
Yeah, nothing specific.
Thank you guys for watching Surgical Secrets with Dr. Nair. Remember, if any questions or concerns, to call 305-488-5707. Stay tuned for more of our episodes.
See you guys next time.